We'll start off by looking at the early days of psychiatry in Britain up until 1865. The term psychiatry was coined by the Greek physician and philosopher Hippocrates, who wrote about mental illness in the 4th century BCE. Psychiatric treatment in the UK can be traced back to the 18th century with the opening of the Bethlehem Royal Hospital in London in 1774. It was initially intended for those suffering from both physical and mental illnesses, but soon became overcrowded and a place for people with severe behavioral issues. In 1814, the hospital opened a purpose-built mental health facility at Corney Hatch, which included cells for patients who were described as incurable and dangerous. This institution eventually became known as the Retreat at Corney Hatch. Though not in the positive sense, in the mid-19th century, the moral treatment of mental illness was developed by French physician Philippe Pinel, and this involved treating patients in a humane way to improve their condition. This approach contrasted with the more restrictive and custodial approach that was used previously, and had been in use at Bethlehem since the 16th century. Moral treatment emphasized cleanliness, good nutrition, and socialization, as well as occupational therapy. Pinel's ideas were translated into English in 1838 and quickly gained traction amongst like-minded doctors in the UK. For example, William Tuke, a Quaker and owner of the Hallowell Institution in York, was inspired to adopt these ideas, and in 1841 he opened the York Retreat, the first purpose-built psychiatric hospital in Britain. Moral treatment became the dominant model of care for most of the 19th century. In 1841, the Medico-Psychological Association was formed, and it was renamed the Royal Medico-Psychological Association in 1865. It still exists today as the Royal College of Psychiatrists. This association advocated for a less custodial and more medical approach to those suffering from mental illness. As such, it supported the training of specialists in mental illness, who would be qualified to treat patients in a medical rather than a custodial setting. This was a direct challenge to existing medical authorities at the time, who viewed mental illness as a social rather than a medical problem. It took many years, but by the turn of the 20th century, psychiatrists had been accepted as full members of the medical profession. The early work of the RMA was done in private practice and in private hospitals. The association only became corporate in 1926, when it acquired its own hospital. However, the association continued to campaign for improvements in public mental health services, and between 1926 and 1971, they made considerable progress. For example, the association helped to establish the first psychiatric clinics within general medical departments, the first psychiatric units in general hospitals, and the first psychiatric social work training courses. They also published clinical guidelines, professional standards, and training recommendations. These efforts were successful, and in 1971, psychiatry became a fully fledged specialty within the medical profession, and the association's name was changed to the Royal College of Psychiatrists. It's worth highlighting that during this period, there was still a lot of stigma surrounding mental illness. Treatments were sometimes experimental or even harmful, and people with mental illnesses were often stigmatized and marginalized. Despite this, the work of the RMA and the subsequent RCP laid the foundations for modern psychiatry in the UK. And without their work, the field of psychiatry as we know it today would not exist. With that said, let's now move on to the second part of the video, where we look at psychiatry in the UK from 1971 to the present day. If you're enjoying the video so far, please consider subscribing to the channel to stay up to date with our latest medical education videos. Let's begin by discussing the impact of the NHS on psychiatry in the UK. The establishment of the National Health Service in 1948 had a profound impact on psychiatry. It led to the creation of psychiatric hospitals as well as community-based mental health services. One of the key developments in the early years of the NHS was the introduction of community care for people with mental health problems. This was seen as a positive step towards reducing the stigma associated with mental illness and providing more accessible and appropriate treatment options. However, over time, the emphasis on community care began to shift, and there was a growing recognition of the need for specialist mental health services within the community. This led to the development of community mental health teams, which were multidisciplinary teams consisting of psychologists, social workers, and other healthcare professionals. These teams were responsible for providing a range of services, including assessment, diagnosis, and treatment of mental health problems, as well as crisis intervention and care coordination. Another important development in the history of the NHS psychiatry was the introduction of the Mental Health Act. In 1983, this legislation aimed to reform the law relating to the care and treatment of people with mental illness and mental disorder in England and Wales. It introduced several important changes, including the requirement for mental health professionals to provide treatment in the least restrictive environment possible and the introduction of patient advocacy services. The Mental Health Act has been subject to several reviews and revisions since its introduction in 1983. In recent years, there have been calls for further reform, particularly in relation to the rights of patients and the use of force in mental health settings. Despite these calls for reform, the Mental Health Act remains the primary legislation governing mental health services in England and Wales, and has played a significant role in shaping the field of NHS psychiatry. Moving on, let's discuss some of the key challenges and issues facing psychiatry in the UK today. One of the most significant challenges facing psychiatry is the high level of demand for mental health services. This is due to a number of factors, including an aging population, increased awareness of mental health issues, and a decline in social support networks. As a result, there are long waiting lists for mental health treatment, and many people with mental health problems are not receiving the help they need. Another challenge is the shortage of mental health professionals, particularly this is due to a number of factors, including the demanding nature of the work and the relatively low pay compared to other medical specialties. The shortage of mental health professionals has led to difficulties in recruiting and retaining staff, as well as difficulties in providing timely and effective treatment. Despite these challenges, there have been some positive developments in the field of psychiatry in recent years. There has been a growing recognition of the importance of mental health and a greater willingness to seek help for mental health problems. There has also been a move towards more integrated and holistic models of care, which take into account the physical, psychological, and social aspects of mental illness. For example, there has been a growing emphasis on the importance of early intervention in psychosis. Early intervention services are designed to provide intensive and coordinated treatment to people who are experiencing their first episode of psychosis. The goal is to help them manage their symptoms, improve their quality of life, and prevent the illness from developing into a chronic condition. These services typically involve a multidisciplinary team of mental health professionals, including psychiatrists, psychologists, social workers, and nurses. Early intervention has been shown to be effective in improving outcomes for people with psychosis, and many mental health trusts now have early intervention teams in place. Another positive development in the field of psychiatry is the increasing use of technology in the delivery of mental health services. Technology can be used to deliver a range of mental health services, including therapy, counseling, and medication management. This can help to improve access to mental health services, particularly for people in rural areas or those who have difficulty accessing traditional face-to-face services. To conclude, The field of psychiatry in the UK has come a long way since the early days of the moral treatment movement. From the establishment of the NHS to the introduction of the Mental Health Act, there have been many significant developments that have shaped the field. While there are still challenges to overcome, such as the high level of demand for mental health services and the shortage of mental health professionals, there have also been positive developments, such as the increasing use of technology in the delivery of mental health services. As we move forward, it is important to continue to invest in mental health services and to ensure that everyone who needs help can get the treatment they need. Thank you for watching. If you found the video useful, please remember to subscribe and leave a comment below. Also be sure to check out our other videos, which cover a variety of medical topics. Thanks again for watching, and see you next time.